Currently, there are more pediatric ICU patients than there are beds in Ontario, and this comes as children's hospitals continue being flooded with sick kids amid an early wave of seasonal viruses, and despite assurance from the health minister today that the situation is under control.
I completely understand your distress, your concern, but you have a government who has your back.
Health Minister Sylvia Jones reassuring parents that their sick children will get the health care they need in a timely manner. But the numbers tell a different story. According to the latest public data, there are now 114 pediatric ICU patients in the province and only 112 ICU beds. And Sick Kids, Canada's largest pediatric hospital, says its ICU is currently operating 127% over capacity, with 50% of those children on ventilators. Today, Minister Jones told reporters that capacity to treat critically ill kids has been increased by 30%.
We anticipated a surge in our pediatric hospitals and took early steps to prepare. Ontario Health and our hospital partners developed surge plans. I will point very directly to CHEO in Ottawa, where they were able to change a ward area into pediatrics.
The Children's Hospital of Eastern Ontario calls the move unprecedented, but is still swamped with the number of kids who need to be hospitalized.
Part of this is ensuring that kids can get care that they really need closer to home, so we can stop sending kids across the province.
Last night, we introduced you to a little boy named Tyler who was so sick with RSV he was about to be transferred to a hospital in Buffalo due to a lack of beds here. Luckily, one became available in the nick of time. His mother telling CityNews it was the worst experience of her life.
It was petrifying that the system had 0 beds anywhere across Ontario. They called through Ottawa, everywhere, London, Hamilton, Toronto, everywhere, and there was nothing available. Literally not a single bed.
Since Tyler's illness in mid-October, things have only gotten worse. According to the data, on November 10th, Ontario was short 10 pediatric ICU beds, and overall only 3 have been added to the system since July. To create more space for the wave of sick kids with flu and RSV, surgeries are also being delayed. Surgical activity at Sick Kids is down 40%, and other pediatric hospitals like McMaster are also making those tough decisions.
We've reduced our pediatric surgical activity requiring a hospital admission to 1 case per day or less than 5 per week, which is down from more than 15 per week.
And according to McMaster, the type of children's surgeries being postponed right now are hernia repair, tonsillectomy, benign tumor removal, some urological conditions, nerve reconstruction, spinal cord deformities, and cleft lips and palate. Now, aside from defending the government's handling of the pediatric health crisis, the Minister of Health announced today that the government will provide an additional $827 million to hospitals across the province. The investment will help increase capacity, build new healthcare facilities, and renew existing community health centers.